So if we look at the recommendations of screening, there are several recommendations of screening, and the recommendations would say that after the age of 40, so between 40 and 50, the woman should have a screening mammogram done every 2 years, and after 50 it should be annual mammogram done for women after 50. This is a Western recommendation which we also have followed. It has got a lot of limitations. The first limitation is it practical to adopt it in our country? Even in the West, where the population is affluent, they are struggling to implement this strategy of an annual mammogram after 50. This is the first limitation, how to go about in a widespread population. The second limitation is one has to look at it scientifically. Is it really that effective?
Correct.
Now, if we look at a mammogram, for every breast cancer that it detects, it detects certain suspicious lesions, 2 or 3 more suspicious lesions for every breast cancer that it will detect, which means that these people who do not have actually breast cancer and have certain suspicious lesions would go for biopsies. So we increase the investigations, we increase the cost, and then we detect one breast cancer which might have been detected if the woman was a little more vigilant about her body. So my recommendation to all women would be that if you could get screening done, go ahead and do it every 2 years after between 40 and 50, and every year after 50. But at least be vigilant about your own body. If there is an unexplained lump in the breast, please do not hesitate and go to your doctor. That doctor would investigate you. There we call it a triple test that we do: a clinical examination, an imaging study, which may be a mammogram or an ultrasound, and a biopsy or an FNAC. These triple tests would tell us whether the lump is benign or malignant.